So shall we start?
Yeah.
Yeah. So good afternoon, everyone. I think we have 23 people in this group, if I'm not mistaken. So welcome, everyone. We are in a very interesting session. We'll be discussing about fighting COVID-19, the women living at a time of crisis. We'll be having a very interesting, inspiring conversation with four amazing women here, including Supinya Klangnarong from Thailand, Anthea from Singapore, um, Fatima Lorenzo from the Philippines, and Dinny from Indonesia. And I'm Kritaya Sreesunpagit from Thailand, um, which I'll be your moderator for this afternoon. Okay? So hopefully we have a very interesting conversation coming up. So first, I would like to ask everyone to give a sentence to tell us about yourself. Okay. So I'll jump start. I'm retired. In Thai, my name would be U, and I'm a bridge builder. I connect people, like Inspire, and I would like to empower people to find their hidden gems. So that would be me. Anthea, would you like to go next?
Hi everyone. Good afternoon. Hello from Singapore. I wear multiple hats. One of which is a member of parliament. Just recently in the Singapore Parliament, but I've just stepped down with the new elections that we had recently. We were actually gonna try to do a 7-word biography as a way of introducing ourselves. That you can check me out on the web about the other projects that I do. But my 7-word biography is a full-time human being and part-time everything else. Here, happy to be here. Thank you for having me.
Thank you, Anthea. Supinya, would you like to go next?
Good afternoon and hello, all analysts and everyone who in this room. My name is Klangnarong. So, if I have to introduce myself briefly, first I use my bio from Twitter. Bio from Twitter is a former commissioner of the National BTC, which is a regulator of Thailand, and a free bird. Working on digital right, vipassana meditation, and that's my.
Thank you, Supinya. Dinny.
Hi, I'm Dinny Jusuf. I'm the mother of Rani. So I always introduce myself. Obviously, I'm a mother, a wife, and a dreamer. But I practice with our CEO this afternoon with your idea of 7 words biography, Anthea. So Aparna and I we discussed, and she says I'm a dreamer, I'm a connector, adventurer, but I'm caring, but I'm impatient, and naughty, youthful, playful, and I smile even though sometimes I cry inside. So 7+ words. So that's me. I'm the founder of TORAJAMELO. We work with around 1,500 weavers across East Indonesia to cut poverty, to give them an option so that they don't become migrant workers. Thank you. I'm happy to be here. Talk to you.
Thank you, Dinny. Fatima.
Hello, everybody. Good afternoon from Manila. I'm Fatima Lorenzo. My nickname's Girlie. So, my advocacy is to integrate psychosocial services in the public healthcare system. 7 words. Thank you.
Thank you. I love this, and it's so interesting that we are all in different countries, and I can feel like I'm visiting each of your homes and offices. So very nice to you spend time with you this afternoon. So why don't we get started and let's talk about what are some of the issues you see arising in your community or your work since this COVID-19 pandemic, and how have you shifted or adjusted your work accordingly? Yeah. So maybe Fatima, would you like to start with that? And we'll have
Okay.
about 2 or 3 minutes each,
Yes.
approximately.
Okay. So the main issue in our community, so ours is mostly public hospitals, is the lockdown. Is when our hospitals are locked down, the pediatric wards are locked down because the medical personnel are infected with COVID. So we, the team, our team from Kythe Foundation, we are not able to visit the patients and families to provide psychosocial support. So the only way for us is to reach their patients is through digital or online services. So this is what we did. First, for our team, we had to ensure their mental and physical well-being. We did this through our weekly check-ins. We asked each member their mood meter, 1 being the lowest to 10 being the highest. And in second, we did an inventory of the technical capacity of each Kite team member. Do they have the appropriate gadget and internet service? And luckily, the board agreed to provide the team members additional funds to upgrade their gadgets and their system. Third, the team co-created online activities and set up group chats or Zoom meetings for the patients and parents. Activities such as digital storytelling, parent sharing sessions. We also provided funds through online facilities to the parents for their prepaid internet service so they can join the online group activities. Fourth, the resource mobilization team also created campaigns such as food for the kids because our sector works for belong to the no work no pay sector, so it was very hard for them to buy meals, so we provided some income or some subsidy for them to buy meals. We also have the hospital safety kits, and for psychosocial activities for the kids, personal activity kits which they can do at bedside. And lastly, we mobilized our volunteers to provide monetary or in-kind support. We tapped our volunteer groups who are better equipped to go to the hospitals, those who have PPEs and manpower and the vans to deliver meals to patients, carers, and frontliners. Thank you.
Thank you, Fatima. Dinny, would you like to follow up after?
Okay.
Yeah.
Sure. So, what are the issues during the COVID-19 pandemic, and how do we pivot to face this? So, because we work by strategy and by choice, we work with communities of women who usually go abroad to become migrant workers, and for that they have the risk of being abused, killed, or get pregnant. So through a hand woven textile or hand weaving, we want to give them another choice. So we basically work in the areas where there are many women who go abroad to become migrant workers. Second, they haven't received much help from the government and or other NGOs. And third, of course, they do have hand woven textile art and culture. And during this COVID-19, the impact is very fast. It's about deepening poverty because at the beginning of the COVID-19 pandemic, the government almost locked down all transportation, logistic, and all that. And we work in the outer islands, eastern part of Indonesia, which is like the poorest of part of Indonesia. And because during our second president's time, basically we were made to eat rice. Well, actually there are other grains that we can eat. So with the lockdown, the price of rice, because rice comes from other parts of Indonesia, become very expensive. So that's just one sign of poverty. And other things is about mental health. Now we are like, it's in Indonesia. It started in March when we found the first COVID-19 victims or yeah, victims. And now it's about 4 or 5 months down the line. There is a lot of mental health issue, and we also notice very fast the increase of suicide. Suicide among the poor. Even in my area, it's a beautiful area in Toraja. Almost at least once a week, somebody just hang himself or herself, mostly men. So the issue is deepening poverty and then mental well-being. And of course, for us as a social enterprise, is the funding opportunities that become less or almost non-existent. And of course, slow business. So that's my side. And what do we do about it? How do we pivot? For a few months before COVID-19, actually for a few years, we have been planning to have redirection, reinventing of TORAJAMELO, because I founded TORAJAMELO with my sister Nina Jusuf, and we know that at one stage we have to give it to the fresh blood, to the younger generation. And because of COVID-19, and we realized that we cannot do it our old way, so we do our reinventing or regeneration of TORAJAMELO faster. So starting June 1, the CEO is not me anymore. It's Aparna Saxena, who's I think somewhere here in the audience. I'm so happy that she is so brave in taking the risk to take charge. And the other thing is digitalizing. So it's very amazing because at the same time that COVID-19 is happening in Indonesia, the government makes sure that we are all connected, even to the outer islands. So I think that there was one satellite connecting that they just launched, connecting the eastern part of Indonesia. And now Aparna and myself, we can have Zoom meetings with our weavers. It's amazing. They may have to go to near the beach, open area, but we can talk to them and continue our training. Yeah, I know, it's amazing. And the other thing is, because of the poverty that goes very fast, of course, we have to do to create cash for them very fast also. So we have done this campaign we called Wito Corona, or Weaving in the Time of Corona, taking from the novel of Gabriel Garcia Marquez. So Weaving in the Time of Corona is basically selling the handwoven textile from the communities at very low price. It's basically low margin, so that they can get cash fast, because they don't want to receive any donation. They want to work, sell their weaving, and get that money. So that's just some things that we have been doing.
Thank you, Dinny. Yes, we are more separated, but also more connected, one way or the other.
Yeah.
Thank you for highlighting that.
Yeah.
Yes. I would like to pass it on to Kun Supinya, please.
Can everyone hear me? Okay.
Yes.
Thank you for having me here, and hello to everyone who following our discussion. Yes, I would like to talk about our work. It's called COFAC. COFAC is come from collaborative fact checking, which actually we planned before the COVID time, but just in time that we started to launch early this year. COFAC is we're having a chatbot, and we're having a database website helping people to fact checking. So actually our main work is creating a tech tool, civic tech, to help people fact checking the information about the COVID-19. As you might know that we have a COVID-19 and coronavirus, but at the same time we also have something called the infodemic, which came from information and pandemic. This term being used by UNESCO and also the WHO to describe the situation of the overload of the information, and sometimes the information itself became a virus with spreading misinformation and disinformation to the public. And in many countries, those mis and disinformation can cause danger to life because people believe in that information. In Thailand, we had a similar situation that during when the COVID-19 started, there were confusion and there are a lot of mis and disinformation. But compared to many countries, I think we still manage it. It's still under control. But somehow, because we need people to change the culture, we believe that everyone is a fact checker. Like Ashoka believe that everyone is a change maker. But in this information era, we all have to be a fact checker ourselves. We could not rely on the media to provide information to us because sometimes it's not enough because information coming to us all the time. We are our social media, maybe especially our app chat that is a close circle. So that's why we created chatbot for people using Line chatbot. Line is similar to WhatsApp. Normally, rumors spreading via the chat app. So we create chatbot or AI to help you. You can copy news or information you are not sure whether it's correct or not, and you can put it in our Line chatbot, and information will be given to you whether this one is already verified or not. So, briefly, we think that information, we believe the same as UNESCO said, not only nurse and doctor are the lifesaver during the COVID, but information are lifesaver as well, especially fact. That's why fact matters and what we can contribute to the situation that we're using civic tech to help people. But only chatbot alone, only website alone, only technology alone are not enough. We need to engage with more technology and community. Make us to create a culture of collaborative fact-checking because sometimes there are no single truths. So that's why we need a collaborative fact-checking. Before I end this, we did not create this by ourselves, but we learned this model from Taiwan, not Thailand. COFAC is originally created by Taiwanese activists and supported by Taiwanese Digital Minister Audrey Tang. You might heard about her name. Inspiring during COVID and before that and beyond that. So we had her as a guest speaker last year talking about how to tackle fake news, and then she inspired us with the COFAC model, and we started to follow that model and develop in our Thai style model. Unfortunately, it's still in Thai, so you cannot use it yet, but hopefully we could have an English version so you could come to help us fact checking in our COFAC. Thank you.
Thank you, Supinya. And lastly, I'll pass it on to Anthea. How is it on your end?
Thanks, Kritaya. Thank you. Because I work across so many communities with the different hats I wear, I think this question will take hours for me to respond. So maybe I just group the issues into three broad categories, which I call the 3 M's of my heart. Mental health, which Dinny also alluded to, marginalized communities, and also migrant workers. COVID-19 did not necessarily create new problems, but certainly illuminated the structural cracks in these 3 M's as bigger problems. So like mental health, for example, many people have reached out for help because their lives are turned upside down. If you think about the overwhelming anxiety with the future in terms of job and income losses, this is very real. In fact, I had an acquaintance who almost killed himself because he had lost all his jobs and gigs as an event MC. Another single mother I know, the young boy and an elderly mother, has actually her salary cut initially to 50%. Now she's only left with 25% because she happened to be in the hospitality industry. So you can imagine the kind of stress that she would have as a single mother. And then business owners and the employees are not spared either. A small business owner I know whose family business has been around for the last 50, 60 years is just in deep despair because he's got to retrench workers who have been with the family for over 20 years. So I think mental health it's actually really cutting across the entire society. Mental health has been an area I've been advocating for the last 14, 15 years because of my own close shave with depression as well. So that's been a lot of the issues that have been arising. In fact, I think there's a study recently that says 1 in 2 employees in Asia have actually suffered an adverse effect on mental health since COVID-19. So I don't want to go more into the suicides, but we are also hearing a lot about suicides. There's the spike in suicide, the spike in domestic violence, which I think Vice President Lenny also shared in her keynote. And I think there's also certainly this this group of seniors, especially the vulnerable ones who are living on their own, feeling isolated and lonely, particularly if they are not digitally savvy. And so I think this also highlighted the issue of a deep digital divide that still happen even in a place like Singapore, which is obviously one of the most connected cities in the world. So those are some issues to mental health. I could go on, but I'm sure this is not unique in Singapore. In fact, some have called mental health the other COVID-19 crisis. Marginalized communities. I would like to highlight actually, especially women in need, or sometimes we call them vulnerable women in our midst. And that could be migrant spouses, elderly caregivers, single mothers, foreign domestic workers in Singapore, or those affected by family violence, as we spoke about. And I think this is an area that we really need to look at. I think, again, I was very heartened that VP Lenny highlighted that across the world, we are seeing COVID-19 affecting men and women differently in ways that exacerbate actually the gender inequalities for women who are often the hardest hit. And that's also the same in Singapore. Women play an outsized role responding to this crisis, whether it be frontline healthcare and social workers. I'm sure Fatima or Girlie would attest to that. Caregivers at home for the young and elderly, and also even as mobilizers in their community. So that's been a big issue that we're seeing here. And last, for me, as migrant workers, and I'm referring to the low-wage migrant workers, both the non-domestic as well as domestic. This, for me, in COVID-19, I think this has been the most vulnerable group, at least in Singapore, because they are unfortunately not protected by the many support measures since they are not citizens, right? They are transient workers. So yeah, we actually recently saw a spate of suicides and self-harm incidents amongst our migrant workers who unfortunately have been confined to their dormitories for the last 4 months because there's been a major outbreak, and I'm sure you've heard of that. Singapore's COVID-19 cases, about 85 to 90% are from the migrant workers in the dormitory. So how have we dealt with that? I won't go into too much details, but in my head as a member of parliament, I have raised many of the policy gaps in these areas, the issues that I've raised, and I'm also pushing in terms of policies that we're not just looking at Band-Aid solutions, but also structural solutions and structural policy changes. One of the things that I challenged was we had this disparity between mental health insurance for physical health conditions versus psychiatric treatment. And so that's been something I've been pushing for, and the government in the last parliament, in the last debate, agreed to do a whole of government review. So that's very heartening. Same with migrant worker policies. The 3 social enterprises that I have, the 3 social projects, we had to pivot. Hush Tiba, which is one of it, a social enterprise led by the deaf, the hard of hearing, and people with mental health conditions. We had to move everything on Zoom, very much like what Dinny shared. And that's to support mental health challenges across society and at workplaces. I also form a community of change makers. We are looking to work with Ashoka here more openly with Singapore, but we also galvanize community change makers to address some of these key issues that I've raised. Thank you.
Thank you, Anthea, and thank you for all of you. This really needs to be a 3 days conversation or more, right? There's so many issues that's arising in this pandemic. So I think we have about 10 minutes left. So I would like to combine the last two questions together, and would like to ask you to highlight the challenges and the opportunities that you see during this time, and moving forward into the future. I'll put that in here too. Kun Supinya, would you like to start with that? What are the challenges and the opportunities that you see during this COVID time?
Of course, the challenges for us in the infodemic, we need the super corrector to fight the super spreader in the information age, and that we need a literate citizens. So what I observed during the past few months in Thailand, I observed many people became more alert and fact-checking more on the information they receive. But in order to reach the wider audiences of people to use our technology is still very challenging, because so far only 1,300 using our chatbot. I think it's still very low number because we haven't done campaign to reach the audience yet. And yeah. And in order to not only introduce people to use technology to fact check, but we also have to change the mindset and the culture. Sometimes people tend to believe because they want to believe so. And that's difficult in fact checking as well. Whereas example, when talking about countering the virus, maybe there are some people believe in using like herbs, alternative medicine, but sometimes it would against the idea of scientific belief or the modern medicine. So sometimes when we have to fact check some news and information spreading in the community that eating that will help preventing COVID. Sometimes it's really difficult because people maybe have their own idea of culture of eating is a medicine, but in the modern medicine they don't believe so. So that's why we need co-fact. I mean, sometimes we could not say that one thing is absolutely wrong or one thing is absolutely false, but we need people to share knowledge and idea based on facts. Sometimes it could be on belief as well, but it should not against facts. That needs a long process of engagement. I think that's the challenge, but somehow we saw opportunity from this COVID-19 that people more alert on the health issue and people fact-checking more and people discuss more in the open public platform. Thank you.
Thank you. So I would like to pass it on to Fatima. What are the challenges and the opportunities you see in this COVID-19 time?
Yes, our biggest challenge now is some of our corporate partners have already informed us that they can no longer give us donation because they've cut their income and the economy is very low. So the opportunity there is that we will have to increase our individual donor base and go off online marketing. And the opportunity for us is to tap our student college volunteers to create content, digital content for us because they're the tech savvy and they know the market. They know the online market, so they know what to put out there. So that's what we're going to do. We're going to tap these young leaders, young creative students to create our content so that we will be able to sell merchandise online. Thank you.
Thank you. Julie, please.
Me? Okay. Challenges, there's a lot, but of course, one of the main issues are like I think we are not seen as a sexy social enterprise for people to invest in, because we are social enterprise or not NGO or non-profit like that. Yeah, so we have to have. And often we are missed out even before COVID-19. We like fall in the crack among the startup technology, startup young run by young people. So that is a challenge and continues to be a challenge for us. But at the same time, we see opportunities because Indonesia, we have about at least 75 million of young Gen Z millennial. So with the new team, we are pivoting to our target market is to the young. So we have to change because we created products. TORAJAMELO has 3 income streams. The first is commerce or creating products. So we have started working with young designers so that we can design fashion products, gift products, which are will interest the young generation. The second is community-based tourism, which is a bit hard now with COVID-19. But interestingly, we have had calls also from people because now I think travel is changing also. People don't want to travel in big groups. They want to travel just 2 of them, and they want to go to the villages, to nature, and we have that. And the last one was consultancy. We see a lot of chance to work as consultant because of our 12 years track record. But to match with the new target group, we are also now calling. I'd like to use this platform to call. We would like to invite the young Indonesians or the young to work with us to help the rural poor women, to help also the art and culture heritage of Indonesian weaving. Because with COVID-19, we need to digitalize. We need to work in a different way. We need to have content which is interesting to the young. And I'm proud to say TORAJAMELO, we have a lot of stories. We have real stories, we have real communities. But how to make it interesting in the market, that is a challenge to us. So again, I'm inviting all the young out there to join us, to join the young team of led by Aparna. That's from me. Thank you.
Dinny. So you are your goodie. We're looking forward to seeing you and your organization being more. So, Anthea, passing it on to you. Anthea,
Anthea, no voice.
Sorry.
would you like to
So I'll keep it really brief. I know we are actually really coming to the end of this session. Thank you, Jaya, for letting me have the last word. I think instead of seeing the big C in the weight challenge, I would like to think about 3 other C's that I wish to focus on as I move forward. With all the different social enterprises and projects that I am involved with. One is clarity. How do I be clear and transparent in communication and set expectations to employees and communities, given the uncertainty and volatility, right, of this whole situation we're in. The other is very important is, how do we not stop experimenting and being adaptive? I really do think that if we want to stay and remain status quo in such disruptive times, then that's really going to add on to our suffering. The last C, which is a combination of 2 C's, is care and compassion. And I think there's so much of an opportunity now for us to listen, not just actually to listen to our communities, but also our employees, but also ourselves and our family. And I think that's really given us a opportunity to also understand more about who we are as a person, as a woman, but also as a leader. And hopefully in doing so, we can start to find ways and find new possibilities with the change that we want to make as change makers. Thank you.
Thank you, Anthea. So, yes, this is some such an interesting conversation that I feel like we really need more time to go into more discussion about what the issues that has been raised here, and also the possible collaboration among us and among the groups of amazing women here. I have just been told by the organizer that we actually have 5 more minutes. A bonus 5 minutes. So
I didn't have to speak so
any last
fast then,
words that
Kritaya.
yeah. So you can take a breath and any last words anyone wanna share about your work, or maybe about your hope and dreams and the way forward. Um, anyone can start.
May I start?
Yes.
Okay. Well, for silver linings or moving forward or lessons learned from this pandemic, it's really one is we really have to take care of our people, of our organization, the team members. We have to take care of their mental and physical well-being, and the administration or the board of directors of each team should think about really going the extra mile to take care of your team, because what's important is we may have all this digital technology and all that, but it's really the human resource that is still important, bottom line, in this pandemic. And uh, we have to create that enabling environment for our team so that they can be creative and be resilient. Thank you.
Thank you.
If I may add to that, Fatima, I think after being locked down at home for more than 4 months, even though it's a beautiful place, I think we also have to take care of ourselves, because we don't realize that like some. I have to admit there are like really bad days, and sometimes I'm embarrassed to say that or to admit it. But I think what surprised me was talking to the leaders of organization or companies who are partners of TORAJAMELO, and one by one they start sharing, like, Ibu Dinny, I'm so depressed. I don't think I can talk anymore. I need to go away. Ibu Dinny, could you take time? Could you give me more time? I just cannot function. So I think we also have to take care of ourselves. Take a more walk with your dog, with my dog, and quiet time. Uh, and we have to like realize and respect how we feel, how our body, our mind. And for that, I'm grateful to my daughter Rani, who keeps telling me, please take care of yourself, ma. So yeah, and let's be compassionate to others too, even more so, because we don't know how they feel, how they are going through all this. Yeah, thank you.
Thank you, Dinny.
So me? Okay, so I forgot to tell you one thing, that we are proudly present that not only me are a woman in this COFAC team, but most our crew, our staff are women as well. And because before we have many of fact checker organization, it seemed that many of males workers and males representation, but we have a majority is women working in this team, and I think we see more perspective from our work, which I don't have time to tell now. And also we are so inspired by Audrey Tang, which is a transgender woman, digital Taiwanese minister. So I would like to quote her words, saying that in this infodemic and mis and disinformation and dark sides of the social media, which sometimes we don't know who we can trust, or sometimes we could not trust the press, sometimes we could not trust our government. So who can we trust? That's the question asking Audrey Tang when she was in Bangkok last year. And she replied us with one sentence saying that sometimes it's good that you cannot trust anyone, because sometimes blind trust is worse than no trust. So actually, blind trust is worse than no trust. So it's good that sometimes you cannot trust any information, because it will help you start to ask questions and fact checking rather than just having blind trust. So think the otherwise, that sometimes no trust is better than blind trust, or blind trust is worse than no trust. So that's why co-fact or collaborative fact-checking comes, that we need everyone to be a fact-checker, and then everyone can be a change maker. Thank you.
Thank you. So last word to you.
Yeah. Yeah. That was really beautiful, the way we wrapped up, especially Dinny sharing about self-care. I would like to also say that this is a great opportunity for us to take this great crisis to do a great reset for the way that we see the world's problems. Because for a long time, I think when it comes to social policies around the world, we tend to assume that the vulnerable communities of our society must depend on external and institutional services to get by. But I would like to sort of challenge us to say, how will our work look like if we don't see these vulnerable communities as problems of society, but as pillars of strength, of their communities? How can we sort of enfold them as the solution? What resources do we need to avail them with? Because I really do think that their vulnerability need not be a measure of their weaknesses. Their wounds actually can be turned into wisdom. And I think we, as women social entrepreneurs, we are just the most best placed to facilitate and empower them to be agents of change in their own communities. I would like to also leave you with this Zen philosophy, which says that in an expert's mind, there exists few possibilities, but in a beginner's mind, there exists many possibilities. So I've been trying really hard to practice this, staying open, curious, humble, so that I see challenges as possibilities and not threats. Thank you so much for having me.
Thank you, everyone, for an inspiring afternoon. There is so much food for thought and so much insights. So take care of yourself, take care of your people, and take care of your trust. And I really like that. It's like everything is shifting and resetting and asking us to review many things about ourselves, about our beliefs, about our values, and about how we function together as a community in our local community and also in our community here. So once again, thank you all for joining us here this afternoon, and I hope this inspiration and this conversation can continue after this event. And I think this is a wrap for our session, and we'll see you all again in the main session. Thank you. ขอบคุณค่ะ
Thank you very much. Thank you,
Salamat.
everyone.
Okay. See you in the main session.
Bye bye.